All right, so this is the lecture on HIV infection and the HIV human immunodeficiency virus. So we started noticing infections in the 1980s in men who have sex with men, really odd infections, really odd cancers like Kaposi's sarcoma, um, oral candida infections, CMV infections, atypical pneumonia with pneumocystis carinii or pneumocystis jirovecii. And they started to notice that these were occurring, and all of the patients were gay, and they actually called this GRID. This was gay-related immunodeficiency. Now, the first infections would have occurred in people, decades before this, but it went unnoticed in the medical community for a really long time for several reasons, but in large part because this has such a long clinical latency period. People would get infected and not know it, and then it would get spread around. And so we think this was circulating for several decades before this, but they first noticed it in the early 1980s. Now, the name changed from GRID to AIDS, so acquired immunodeficiency syndrome, and this was spreading pretty quickly. So we had a couple thousand deaths from when they first noticed it to 1983. And then they were trying to figure out what was causing it. And we now know, of course, that human immunodeficiency virus causes AIDS. But at the time, there were a lot of challenges into doing some of this early research, and that's highlighted in the movie and the band played on, which there's a link for you guys to watch this movie on Canvas. And this was, I don't know how many of you guys really remember back in the 80s and even to some degree in the early 90s, there was a lot of fear about this, and because people didn't know what was causing it, and people were just dying. And there was also a lot of stigma, and it was there was a lot of fear and anger pointed towards the gay community, which was really unfortunate. And there was lots of things with gay people shouldn't be allowed to do certain things, or if you have HIV, you shouldn't be allowed to do certain things, and people worried about how they catch it. And there was this paranoid. I remember there was a public service announcement on the news, telling the population, no, you can't get this from, a toilet seat. You can't get this from, playing baseball with somebody. It's because people were really concerned, could you get this through casual contact? And the answer is no, you're not going to get this through casual contact. Now, how did HIV first cross over the species barrier into people? All right, so there's a lot of conspiracy theories about HIV and about how this emerged, and was it a man-made virus and all that, and the answer is no. And honestly, at this point in the semester, I do not have the patience to debunk all of these just frankly stupid conspiracy theories. The facts are we can trace this virus from different primates, and we can track the mutations that were made in these viruses in order to make the leap into people. Right, so we have SIV, which is simian immunodeficiency virus. And this is in several primate species. And then we've got different types of monkeys, mangabeys. And the virus migrated from the mangabeys, from the monkeys to the chimpanzees, and then migrated to people. And people have gone out, scientists have gone out and taken samples from all sorts of different animals and people, and we've been able to show this pretty conclusively. There were a very few proteins that needed to pick up mutations in order for the simian immunodeficiency virus to be infectious in people. And this happened just a couple times throughout history. So we had a separate event for HIV-2 for Suit B mangabase to move into to people. We got HIV-2. HIV-2 is very, very, very similar to HIV-1, but the mutations that moved it from these primates to people were a little bit different than for HIV. And HIV-2 is a little less severe than HIV-1. If you're wondering, we've got A to H and M and O. There are different subcategories of HIV, different strains that we'll talk about later. And then we can see the mutations that were able to go from monkeys to chimps to people for HIV-1. And again, there's another strain, HIV-1, P or O. O stands for the other group because they don't know what to do with it. But this is the main, and actually M stands for major. This is the major event that led to the HIV-1 that's infecting most people around the globe. And we're going to talk about these restriction factors that that mutations in those restriction factors or in the proteins that deal with those restriction factors led to this species jump. So there's a few proteins in HIV that were mutated that allowed the virus to overcome the species barrier that we'll talk about. And it's also important to note now HIV has been adapted to people and it cannot infect primates. And SIV, if you just took SIV, randomly any strain in the lab, or if you just picked one of these SIVs up and tried to infect it into people, it would not lead to infection. All right, so these jumps across the species barrier were relatively rare. And this was, somebody was in the wrong place at the wrong time. So we had exposure, probably eating bushmeat, and the hunter got some blood in a cut or something like that when he was preparing the animal, and the wrong person, wrong chimpanzee, wrong virus at the wrong time. We can trace back by looking at the genetics of the viruses in primates and in people, and we can pinpoint the origin of HIV-1 and HIV-2. And a lot of scientists have gone through lots and lots of trouble to go through and sequence the HIV strains isolated from people and from the primates, and we can trace the evolution of the virus from simian immunodeficiency virus to people, to the mutations that it picked up in people, and then how it spread throughout the world. So how is HIV spread? I think most of you guys are familiar with this. It's present in blood, semen, vaginal fluids, to a lesser degree breast milk, saliva, and tears. Though you are not going to spread HIV through sharing a glass with somebody. You're not going to get HIV through common, casual contact. So sharing your soda with somebody is not going to spread HIV. There's never been a reported case of that. The levels in saliva and tears and even breast milk are pretty low. A lot of the transmission through breastfeeding is likely contributed to sometimes blood. The skin breaks on the nipple during breastfeeding, and a little bit of blood passes. So common ways that HIV is transmitted: through intercourse, through contaminated needles. These are the two really big ones. And in different parts of the world, one takes precedence over the other, but these are the two primary ways. Blood transfusions. Now we have screening. But it is important to point out that in the early days of the infection, like in the early 80s, we didn't really know what we were dealing with and we weren't screening blood. So there are still some people who might have gotten a blood transfusion in the 80s who have been in clinical latency all this time and are just now starting to see the symptoms of AIDS. They had no idea that they were infected. And so now in the population, 45 to 65, we're seeing more AIDS cases, and those people are particularly at risk because they got their blood transfusion before the screening, so now this isn't a concern. Accidental needle stick injuries. This is always a concern for healthcare workers. And this is why when you're in any clinic ever for all time, there's lots of posters all over the place that, instructs you on the proper techniques to use when handling sharps, and, you're not supposed to recap needles and so forth to avoid needle stick injuries. Congenital AIDS, so this would become from mother to child if HIV crosses the placenta or through breastfeeding. And then sharing tattoo needles, razors, acupuncture needles, piercing, and so forth. Again, now there are really specific hygiene rules, and everything gets autoclaved in between people or gets thrown out, and you got a new tattoo needles for each person. So now they have a lot of rules in place to prevent this. But again, before we really knew what we were dealing with, this was a problem for the mainstream public. Nowadays, like I said, they pretty much have this in hand. However, for people in the prison community, for prisoners, this is still a major mode of transmission. Okay, so just to be clear, social, regular, normal kissing is not going to transmit HIV. This in your book, it says open mouth kissing increases the risk. The risk is still really low. Now, if somebody had a cut in their mouth or something, that would be different. Or if you have, a sore, open sore or something like that, but the risk is still pretty low from kissing. But if there's sores, that increases it. Through oral sex, though, yes. So vaginal fluids and semen can contain HIV virions. So the risk would be increased during oral sex, though penetrative anal or vaginal intercourse would still be much, much more likely. All right. Currently, right now, we've got people all over the world infected with HIV. So in America, 2.3 million, Latin America, 1.8, Sub-Saharan Africa, over 24 million, Asia, 4.8, Europe, 1.1 million. So we've got millions and millions and millions of people infected with HIV all over the world. There are several reasons why there are more infections in Africa. One is this was just initially where it started, and so it kind of spread through the population here first. And then, as we've talked about in other classes, there's a lot of heterogeneity in the different countries and even within countries within Africa, and some of them are very modern and you've got good education and good hygiene and good sanitation. They have very modern cosmopolitan cities, and then there are some places that are very impoverished and they don't have good education and they don't have good access to medical care. So there's a lot of different factors that contribute to the rate of HIV in Africa and around the world for that matter. So if you look within the world, and here we've got, let's see, Africa, right? In America, 4% of global cases right? Remaining countries. Sorry if you're from one of the remaining countries. If you were below 2%, they just kind of grouped everybody together. I guess that's actually a good thing if you're from one of the remaining countries, because then you're not being forgotten. You just don't have that high percentage of HIV cases. But you can see within different countries in Africa, there's why did they? Oh, I guess they did it numerically, because India is not in Africa, of course. So I guess they didn't group it up. Anyway, we're going for this lecture's completed, not perfect. So you can see there's a big disparity between different countries and the level of HIV. And again, there's a lot of factors that go into play there. But something to point out, that our global healthcare system, and I hope the current pandemic has emphasized this, and we've talked about this a little bit before in the epidemiology, our global healthcare situation is only as strong as our weakest link, because viruses and bacteria can spread in places where there's not access to great healthcare, and people travel and then they spread to other places. So we really do have a invested need to help people all over the world and try to do what we can to eliminate, well, we're never going to eliminate AIDS, but to drastically reduce it all over the world. So in sub-Saharan Africa, right, in some countries, nearly half or more than 40% of people have access to good treatment. But this varies. So in some countries it's less than that. In some cases it's less than a quarter of the people who are infected have access to good medical care. And this is a problem not just for the people who are infected there, but again, people travel all over the world, and so this is a humanitarian crisis for the people living here, but this also affects the rest of the world when people travel. So there are some places in the world, and there's some places in Africa where the situation is really improving and HIV cases are stabilizing, and then there are other places where they're continuing to get worse. It's really unfortunate. We talked a little bit about this with rabies, but we do have a treatment for HIV now, where we don't have a cure, but we have a treatment. But the cost of getting that treatment to everybody who needs it is prohibitive in a lot of places, which is really unfortunate. In the United States, we for a while were having a big increase in cases, and then we've started to decline over the years as we have a better handle on what HIV is. We've got better treatments for it now, and so the number of cases and deaths of HIV in the United States is slowly decreasing and kind of plateauing. So this is good news in the States. Of course, there are pockets of places where there are still problems, and even in the United States, there are still people who don't have access to or can't afford therapy. So how are most people infected? Right, so in the United States, most people are getting this through male-to-male sexual contact. In other places in the world, the primary mode of transmission might be IV needles, sharing needles, but in the States, men who have sex with men is most of the transmission. And then we've got heterosexual sex is the next biggest chunk. And then we've got intravenous drug use. So there's a lot of good news that a lot of people are getting tested, and a lot of people are getting treatment. And actually now, if you are diagnosed with HIV and you're put on treatment, you actually have a higher life expectancy. It's just ever so slightly, but a higher life expectancy than people without HIV, because they think you go to the doctor so frequently for checkups that you can have really good preventive care for all sorts of other things. And there's a lot of positive news that we're getting more testing, we're getting more people treated, but there's a lot of communities that are still not getting the treatment that they need. So we have this gap that is still a really big problem. A lot of people are still afraid to go get care because of the stigma. They belong to a specific group. And different parts of the world, homosexuality is still criminalized. In different parts of the world, people think HIV, even though there's a treatment, they just assume if they have HIV, it's a death sentence. And so they either don't want to get tested because they don't want that news, or they get tested and they're HIV positive and they commit suicide. There's a lot of discrimination. If you have HIV, then you must have gotten it by being a bad person. There's still a lot of people who are not getting the testing and the care that they need due to lack of resources or discrimination. So, of the communities that are particularly at risk, young girls in particular, especially in places of the world where they don't have equal rights or good access to education, they don't have as good access to health care. The prison population is a really significant one. There's a much higher incidence of HIV and hepatitis C in prisons, which is a really big problem. There's several reasons for that, including contraband tattooing, for example, contraband piercing, sharing of razors and so forth, and homosexual activity. Migrants do not have consistent access to good health care. IV drug users. There's a lot of places in the world where they don't have needle exchange programs, and so this leads to an increase in HIV transmission. Sex workers. Now, prostitution is the oldest profession in the world, and I know that's kind of a cliche, but it goes even beyond humans. You can observe this in primates. You can observe this if you've got a harem of chimpanzees, and you have the alpha male, and he's the one who's supposed to be having sex with all of the males in the group, and none of the beta males are supposed to have access, and he'll chase them away from the females if he sees them. And these beta males are not as big and strong as the alpha male, but they are nicer and sweeter to the females, and they will go out and find fruit. They will bring the tastiest fruit. They'll try to sneak it to the females. Here's some fruit. Please have sex with me. And it works. And if they go through and actually test all of the children, do paternity test of the new chimpanzees born in the tribe, a good percentage of them are born after a sneaky male found some yummy fruit and handed it to the female. They've also done experiments in other primates where they introduce fake currency, like shiny little coins or something, shiny rocks, and they've found that the males will bring shiny rocks to the females in exchange for sex. So prostitution is something that primates do, and unfortunately, there's also a stigma associated with that. And so a lot of these people, you can't say on your taxes, I'm a sex worker, right? So a lot of them don't have good health care, and a lot of them are afraid to come forward because of their line of work. Men who have sex with men, we've there's simply more friction in anal intercourse, and so there's more blood shared, and that's why the rate of infection is higher. Transgender women, actually one of the most vulnerable groups for several different reasons. One, because of their identity. They face a lot of stigma. In some places of the world, being transgender is still criminalized. In other places in the world, being transgender is not accepted. Getting good health care is not an option for all of these women. Some of them still engage in anal sex, so they run the same risk of HIV transmission that way. Some of them who've had gender reassignment surgery, there's also a risk of transmission in the neo-vagina that is could be enhanced. And there's a lot of other just risks and stigmas with if not being accepted and not feeling comfortable going and talking with a healthcare professional. Pregnant women, so a large percentage of pregnant women in lower income communities, and even in some places in America, like Louisiana and Mississippi, a lot of women do not have access to good prenatal care. There's a lot of problems during pregnancy if you don't have good prenatal care, and then you're in a greater risk of then passing HIV on to the fetus or the newborn. Displaced individuals, again, don't have good health care. People over 50. A lot of the symptoms of AIDS also look like chronic infections of other sorts that elderly people would get. So a lot of them don't get diagnosed properly. So kind of the take-home message is, if you are in any sort of demographic that is stigmatized or is poor, and you don't have access to good health care no matter where you are in the world, you're at a greater risk of acquiring HIV, you're at a greater risk of spreading HIV to other people, and you're at a greater risk of developing AIDS from HIV because you don't have good treatment. Other things to just emphasize here. So the pornography industry, and if sex work is the oldest profession, if prostitution is the oldest profession, pornography is probably not too far behind. And people all over the world, in large percentages, consume pornography. And the people who put this on, are at risk, a higher risk of acquiring sexually transmitted infections. And they have passed some laws to help protect porn workers, mandatory condoms, also mandatory testing and so forth. And then some production companies have moved out of those areas to avoid those laws. And now there's actually a movement to let's make condoms sexy, because by normalizing condoms and making condoms sexy, you get more people to wear them, because wearing condoms not only protects against HIV, but lots of other sexually transmitted infections and pregnancy. Condoms are a good idea. Correctional facilities or prisons, and this is not true only for the United States, this is also worldwide. There's a much, much higher risk of HIV and hepatitis C, and having a co-infection of hepatitis C and HIV is not a good thing. So the infection rate 5 to 7 times higher for prison inmates for a variety of reasons. And then older adults, I mentioned this before, but 25% of the folks in the States who have HIV are older than 55, and a not insignificant percentage of them became infected during blood transfusions before they started screening. And they may not know they have HIV, they may have never been tested, and a lot of the symptoms of AIDS can resemble other chronic illnesses that you get when you are older. And our healthcare system overall is improving. The life expectancies of people are improving, not just their life, but their quality of life. So a lot of people 55 and older are still very sexually active, and they can spread this to other people, of course. All right, we're going to stop part 1 here, and we'll pick up with part 2, focusing on this case study in your book.